Hey everybody, I am Katie Ramlow and I'm going to talk to you about right hemisphere brain damage. Um, the majority of my information is from ASHA.org and it had a great outline on what right hemisphere brain damage is, what the signs and symptoms are, what are the causes of RHD, the cognitive communication deficits that come with RHD typically, what treatment is available for RHD, how can I communicate more effectively with an individual with RHD, and what other organizations have information out there for RHD. So first I'm going to tell you what right hemisphere brain damage is. So right hemisphere brain damage is, otherwise known as RHD, is the damage to the right side of the brain, which influences the left side of the body. Since the brain is split up into two sections, typically the left side is for language functions and the right side is for function, problem solving, memory, and reasoning. Damage to the right hemisphere may lead to the disruption of the cognitive processes, which is also used for communication, for appropriate communication. In many cases, a person with right brain damage is not aware of the problems that he or she has. So that is an issue typically with RHD. Now I'm going to tell you about some signs or symptoms of an individual with RHD. These include attention, so the ability to attend to tasks and to focus on one thing at a time. Perception, so this may be visual perception. An example of this would be when you're reading a book, they wouldn't see the left side of the words, they'd only see the right side of the words in the book. So they're missing that whole left side because the left side is neglected, is what it's otherwise known as. Another example would be if they had a tray in front of them, they couldn't see the food on the left side, they would only see the food on the right side. Reasoning and problem solving is another sign or symptom, so they may have difficulty understanding if there is a problem and how to problem solve with the problem that's at hand. Another thing is memory, so difficulty recalling past events. Social communication, otherwise known as pragmatics. This includes like nonverbal things such as jokes that they might not understand, figurative language, and sarcasm. Another sign or symptoms is organization. So their ability to organize and sequence things in order would be a problem. Another sign or symptom is insight. So difficulty recognizing problems that impact their daily functioning. Another one is orientation. So the difficulty remembering dates, times, places, or they may not even be able to remember their child's birthday or their family friend's name. And that may be a problem that will be worked on for them. Some causes of RHD include, but are not limited to, stroke, tumors, infections, and traumatic brain injuries. Cognitive communication problems that are impacted from RHD include, or this is how they are diagnosed. So how cognitive problems are diagnosed. Usually an SLP will come in and check for language abilities, including comprehension and expression. So comprehension means the understanding of what they hear. So can they understand what you're saying? We also call that receptive language. And then for expression, they're looking at, okay, how can they say it? What is their way of expressing with communication? Cognitive processes are also evaluated. That includes attention, memory, reasoning, and problem solving. Typically, the nature and severity is noted after the diagnosis. It is dependent on each patient and what extent of the brain has damage. The treatment that is available for right hemisphere brain damage would be for the patient to see an SLP, which will help them with communication abilities and collaboration between all of their professionals that are needed, OT, PT, their primary doctor should all be included to develop a treatment plan for the specific individual. I'm going to tell you a couple ways to communicate the most effectively with an individual with RHD. So this would include to ask questions and use reminders to keep that individual on topic. Avoid any sarcasm or metaphors when speaking to the individual. Provide a daily routine so that they know their sequence every single day, and it helps them to function too. Break down instructions into small little steps instead of big steps. Decrease any distractions when communicating. Provide appropriate supervision to ensure safety. So that's first and foremost, make sure everybody's safe. Stand to the person's right side rather than their left, because you know they'll be able to see you on the right side. And know where you're at, because that may be due to left side neglect. And use calendars, clocks, and schedules and planners, everything to remind them of important information. Now I'm just going to tell you a couple of resources that I found that you can look up more information on RHD. This includes the American Stroke Association and the National Stroke Association, as well as ASHA.org has great information on RHD that will provide for you. Thanks for watching my video.